A strong childcare system is foundational to South Dakota's collective success. That's because our state has one of the highest rates of workforce participation in the US. In fact, we're routinely placed at the top of the list when it comes to states where both parents with children under 6 participate in the labor force. As a childcare provider, you play an important role in supporting these parents and their children. The following training will help you understand licensing requirements for your childcare facility. Ahead, you'll learn about the following licensing requirements: qualifications of the individual responsible for program planning, staff qualifications, staff orientation, progressive health and safety and ongoing training requirements, record requirements and confidentiality, required reporting, program standards including staff ratios, diapering, discipline, and more, and environmental requirements, including fire safety, sanitation, and hand washing. Let's get started. First, let's focus on the requirements for the Child Center's program planner. In many cases, the program planner and the director are the same person. The program planner sets the strategic agenda for the child care center that they serve, and that's why it's so important to have the right person for the job in place. Specifically, this individual is responsible for developing and overseeing activity planning for children. They also may supervise the center's staff. A program planner must be at least 18 years of age, not have a substantiated report of child abuse and neglect, meet certain educational requirements ensuring knowledge and understanding of children's development. It is up to the program's license holder to decide who will fill this vital position, but childcare licensing will document who among your staff meets the requirements. And remember, if there is a change in who serves as your program planner, you must contact childcare licensing to let them know who will fill the position so their education can be verified. Now that we've covered the basic requirements for the program planner, again, often the same person as the director, let's move on to the basic qualifications for all child care center staff. Since this program might have different names for staff positions than another program, we're going to keep it simple. For the purposes of this training, we'll refer to general terms used in licensing regulations: child care worker and secondary child care worker. A child care worker may serve in a variety of roles: teacher, assistant, or other, but they all report to the program planner and are required to be at least 18 years of age. A secondary child care worker refers to staff members who are under the age of 18. Because of their age, there are specific requirements for this group. Here are some of the things to keep in mind. A secondary child care worker is required to work under the direct supervision of the program planner. Further, no secondary child care worker is to be left alone with children, for example, to take children to the bathroom. Because a secondary child care worker is not yet 18 years of age, they may be counted in the staff-to-child ratios only if they are working at all times under the direct and constant supervision of a person who is 18 years of age or older. In a child care program, staff included in staff-to-child ratios must be at least 14 years of age. In a school-age program with older children enrolled, staff included in the staff-to-child ratio must be at least 16 years of age. Every staff member at the child care center should have the knowledge they need to keep children safe. That's why orientation is a necessary and required step when new employees go through onboarding. In addition to facility-specific orientation, licensing requires that staff complete specific training within 90 days of hire. The training required for all staff includes prevention and control of infectious disease, prevention of sudden infant death syndrome and use of safe sleep practices, administration of medication, prevention and response to emergencies due to food and allergic reactions, building and physical premise safety, prevention of shaken baby syndrome and abusive head trauma, emergency preparedness and response planning, handling and storage of hazardous materials and the disposal of biocontaminants, appropriate precautions in transporting children, recognizing and reporting child abuse and neglect, first aid, pediatric, infant-child CPR, child development. Furthermore, because health and safety are everyday concerns with children in care, all staff and directors must complete training every 5 years. Many of the same topics from orientation are covered in this training, but this information is more in-depth than what was initially covered. Training will be available for your convenience through an online module that contains all categories except infant-child CPR. Again, this process will look a lot like required orientation training. If you access training modules through the Early Childhood Enrichment System or other professional development organizations in these topic areas within the 5-year timeframe, they'll also be counted toward meeting this requirement. Infant-child CPR training, which can be the difference between life or death for a child in your care, is handled a bit differently. Staff are required to complete infant-child CPR training, including hands-on skill testing, within 90 days of the date of hire. You're also required to keep your certification current for as long as you work in a licensed child care facility. Within the first 90 days of employment, if a staff member caring for children is not infant-child CPR certified, that person must be supervised by an infant-child CPR certified individual at all times, at least until their infant-child CPR certification is complete. Additionally, during hours of operation, your center must have at least one staff person on site who's certified in infant-child CPR and trained in pediatric first aid. Record keeping helps track your progress and monitor your quality standards. That's why all staff employed in a licensed program must have a record of employment at the facility. These records can be kept in a number of formats, such as handwritten ledger, spreadsheet, or word processing document, but they must be kept on site and handy for the Department of Social Services to review upon request. For licensing purposes, the following information must be gathered from staff members before they can care for children: an employment application with identifying information such as name, age, address, telephone, education, and work experience, the date their employment started and, if applicable, the date the employment is terminated, documentation of annual training hours, documentation of orientation training, including date and topics covered, a signed statement acknowledging responsibility to report suspected child abuse or neglect, documentation of a background screening. In addition, it's necessary to keep a record of every child that attends the child care program. As with the staff records, they'll be kept on hand should the Department of Social Services request it. As child care providers, you have a unique responsibility to ensure the health and safety of all children in your care. Sometimes events happen that require you to report them to the proper authorities. First off, all child care and secondary child care workers in licensed programs are mandatory reporters of child abuse and neglect. This means you must report suspicions of child abuse and neglect immediately to the Department of Social Services, the state's attorney, or law enforcement. If you fail to do so, you may face a penalty of 1 year in jail and/or a $2,000 fine. All employees are also required to read and sign a child abuse and neglect statement that outlines the requirements for reporting abuse and neglect to ensure understanding of this requirement. That's not the only reporting requirement. Let's talk through a few more. You need to report all serious injuries to your licensing specialist within 24 hours after the injury occurred. A serious injury is defined as one that requires professional medical treatment. Routine bumps and bruises don't count in reporting requirements, but many child care facilities choose to let parents know about those types of incidents. When we purchase a product or a service, whether it's a car or a hamburger, we want to know what we're paying for. The same goes for parents who purchase your services. They'll need to know things like how much they'll pay and when, pickup and drop-off times, your curriculum, and more. There's rarely enough time for a director to spend individually with each new family to explain all the policies and requirements. Each program should have a staff and parent handbook available for reference. As caregivers, an important part of your role is helping children develop in positive and healthy ways. Discipline means managing or guiding behavior, and it's a constant task in licensed programs. You'll need to know what guidance techniques to use, as well as those techniques not allowed to be used. You will teach children through role modeling appropriate behaviors, redirecting inappropriate behaviors, and explaining social norms to children through stories, activities, discussions, etc. The standard for managing behavior in a program is positive guidance, a technique that teaches the child what is expected in order to establish self-control. For example, if a child is running in the center, staff say, "Please walk." This tells the child exactly what is expected. If staff tell children to stop running, it only tells the child what not to do and not what is expected of him or her. You are never to strike, push, or restrain a child in your care. Providing high-quality childcare means making sure you aren't overwhelmed by the needs of the children in your care. Implementing a staff-to-child ratio and maximum group sizes ensures that you have the means to give children the attention and interaction that is essential to their care. It's not just about safety. Ratios and maximum group sizes allow for more and better interactions between staff and children. These ratios differ whether the children in your care are asleep or awake. Let's take a closer look. When the children are awake and active, the ratio and group size requirements help keep them safe and engaged. Please make sure you understand only those directly caring for and supervising the children can be counted in the staff-to-child ratio. We handle the ratio a bit differently for children who are sleeping. It makes sense, right? Sleeping kids require less supervision. In programs where children nap, if the staff-to-child ratio is met within the daycare building as a whole, and sleeping children are directly supervised by at least one staff person per room, your program director can choose not to require all staff to remain inside those classrooms with the sleeping children. Other staff members may complete other duties in the daycare, such as cleaning, preparing lesson plans or activities for the next day, etc. We don't count staff who leave the building entirely. Supervision of children. It's the central purpose of a licensed childcare program. Again, it's about more than providing safety. You're responsible also for helping the children in your care develop in healthy ways. That means monitoring for everything from physical altercations to more subtle forms of bullying. We all know that children can get into trouble quickly. They're danger magnets, risk takers, and learning about what's safe and what's not is a lifelong process. That's why supervising staff members must be able to see and hear the children that they're caring for. Mealtime is an important part of a child's physical, emotional, and social development. It not only provides the nutrition growing bodies need, but also a sense of consistency and stability. For this reason, all programs will be responsible for making sure the children in your care receive a meal that meets 1/3 of the child's daily nutritional needs if the child is present during mealtimes. Each meal must contain a meat or protein, a vegetable, fruit, a bread or grain, and milk or dairy. Snacks need to contain 1 or 2 of the above items as well. To make sure there's space for everyone and to aid in developmental learning for the children, the dining area used at mealtimes needs to have enough seating to accommodate everyone in your care. The table, chairs, and eating utensils need to be large or small enough for the children to grasp and use, and they need to be in good repair. Food allergies are a fact of life, and in some cases, knowing which children in your care have them can be a matter of life or death. That's why, whenever applicable, you're required to develop a written care plan for children with allergies related to, for example, food, pets, environment, or bee stings, etc. The plan should be accessible to both staff and impacted children, and should include known allergies, a plan for preventing exposure to the specific food, the pets, precautions for outside play, etc., signs and symptoms of an allergic reaction, and steps to take by the provider or helpers if a child is showing signs of an allergic reaction. Nap time is vital to the developing brains of infants and toddlers, and it's also one of the moments you need to take the most care when it comes to safety. You can take steps to prevent sudden infant death syndrome by adhering to safe sleep requirements. Here are some things to keep in mind. Place babies up to 1 year of age on their back for every sleep. If baby rolls over on his tummy on his own, he can stay in that position. It is recommended that if baby falls asleep in a swing or a car seat on the way to the center, you should put the child in a crib or play yard to sleep, not in the car seat. Place baby on a firm sleep surface. The crib or play yard needs to meet current Consumer Product Safety Commission requirements. No drop-side cribs are allowed. It is recommended if a baby falls asleep in the car seat, swing, stroller, or infant carrier, move him to a crib or other firm sleep surface. Do not use soft objects, loose bedding, or any objects that could increase the risk of entrapment, suffocation, or strangulation in a crib. This includes blankets, pillows, or bumper pads in a crib or play yard. Research has not indicated when it would be 100% safe to have these objects in the crib. However, most experts agree that after 12 months of age, these objects pose little risk to healthy babies. Refrain from putting blankets over a child's head while they sleep at any time. This is a suffocation risk. Keep the daycare environment smoke-free. State law prohibits smoking in public places, which includes licensed childcare programs. Do not let babies get too warm. Keep the room where babies sleep at a comfortable temperature. In general, babies should be dressed in no more than one extra layer than a caregiver would wear. Baby may be too hot if sweating or if his chest is warm or hot to the touch. If concerned an infant is cold, infant sleep clothing designed to keep babies warm without the risk of covering their head can be used. With the parent's permission, offer a pacifier at nap time and bedtime. Research has found that this helps reduce the risk of SIDS. It is okay if the infant doesn't want to use a pacifier. Try offering it at a later time, but some infants just don't like to use pacifiers. Remember tummy time. Babies need plenty of time spent on their tummy during awake time to strengthen neck muscles. Like nap time, diapering is fundamental to caring for infants and young children. Although there are no legal regulations regarding how often children's diapers are checked or changed, you are expected to make sure the children's needs are met. Check them regularly to make sure they're not wet or soiled. After changing a child's diaper on a changing table, clean and sanitize the surface. Use a solution of 1 ounce household bleach to 1 quart of water. Mix this solution daily to make sure it's at full strength. Staying diligent about these procedures will help protect the children, you, and your staff from infection. Feeding time for an infant should be a warm, loving experience. Practicing proper bottle feeding techniques will help ensure growing infants get the nutrition that they need. Make eye contact, comforting sounds, and talk to the baby. Not only will this help you bond with the child, it'll help you make sure that they're getting enough to eat. You are never to practice bottle propping for infants in your care. Bottle propping is a feeding technique in which a bottle given to an infant is leaned against a pillow or other support, rather than caregivers holding the infant in the bottle. It may result in choking. Providing transportation services can add another layer of convenience for busy parents. If the program where you're employed provides transportation, all safety restraint laws must be followed. These laws require: a child under 5 years of age must be properly secured in a seatbelt or car seat. A child must be at least 5 years old and weigh at least 40 pounds before they are no longer required to use a car seat or a booster seat. Passengers who are at least 5 and under 18 years of age shall wear a properly adjusted and fastened safety seatbelt. No more than one person is intended to be secured in each seatbelt. It isn't uncommon for parents to drop in at childcare facilities to visit their children during the day. You must allow them to visit your program at any time their child is in your care, whether announced or not. There are no exceptions. Children often take medication, either for acute conditions like colds or for long-term medical needs. You'll need to make sure you understand each child's particular requirements. For our purposes, we define medication as any substance that is used to relieve pain or treat disease, or any substance prescribed by a doctor. You need to take medication administration very seriously. If you provide the incorrect dose or the wrong medication, it could be fatal. In addition, you need to establish storage procedures so that children can't access medication on their own. It's the program director's responsibility to set strict policies surrounding medication handling, storage and administration, and that the staff understand and adhere to those policies. A parent knows their child's medical history, and therefore it is their responsibility to determine when their child is to have over-the-counter medication administered. Written parent permission can help reduce the program's liability in administering medications. When it comes to a facility's temperature settings, generally speaking, temperature controls should be set in such a way that children and staff feel comfortable in the environment. To put some actionable definition around the requirements though, keep in mind that adequate temperatures, as defined by the National Health and Safety Standards, are between 67 and 75 degrees Fahrenheit during waking hours. The requirement for nighttime temperatures is no lower than 50 degrees Fahrenheit. The regulations for childcare are not only to ensure the proper care of children, but to ensure the safety of children and staff in the program. The following licensing requirements support the safety of children. Ratios. Help ensure enough staff to evacuate children in an emergency. Unblocked exits. A blocked exit can prohibit or deter an evacuation. Program standards. Ensure you know the procedures for emergency events prior to an event occurring. Fire or tornado drills. Help ensure you and your children in your care are prepared to know what to do in the event of a fire or other emergency. 4 annual fire drills and 1 annual tornado drill must be completed and documented. Storage of personal items. Provide a specific place for children's belongings so they are not on the floor as a trip hazard in an evacuation. Fire alarm requirements. Ensures quick notification to children and staff so all can evacuate safely should there be a fire. And fire extinguisher requirements. Ensures there is an opportunity to extinguish a fire quickly. The U.S. Occupational Safety and Health Administration refers to its infectious control practices as standard precautions. As a licensed child care provider, all licensed child care programs are required to adhere to these practices. Here are a few things to keep in mind. The main thing to remember is maintaining a barrier between your skin and potentially infectious substances. The type of protective barrier should be appropriate for the procedure being performed and the type of exposure anticipated. Immediately and thoroughly wash hands and other skin surfaces that are contaminated with blood, body fluids containing visible blood, or other body fluids to which universal precautions apply. Use sterile gloves when hand contamination with blood may occur. Use vinyl or latex examination gloves for procedures involving contact with mucous membranes. Change gloves between contact with children. Do not reuse surgical or examination gloves. Use general-purpose utility gloves, like rubber household gloves, for housekeeping chores involving potential contact with blood and for instrument cleaning and decontamination procedures. Waste management. Remove nasal secretions with tissues and throw them in the ordinary trash. For spills involving blood or other body fluids, remove all visible soil, and then disinfect the surface with freshly prepared diluted bleach. A 1 to 64 dilution is a 1/4 cup of bleach diluted in 1 gallon of water. Use disposable towels or tissues and rinse mops in the disinfectant solution. Railings are an effective way to prevent falls and injuries. All floor and wall openings, open-sided stairs, open-sided mezzanine areas, platforms, and decks at any childcare facility which are 30 inches or more above the ground level must be guarded by an approved railing or barrier. In order to prevent a child from falling off a platform or over a railing, an approved railing must meet local building code for height or at least 34 inches high, whichever is greater. The railing must also meet local building codes for spaces between rails or have no more than 4 inches between open spaces, whichever is greater. Cleaning and sanitizing are an important component of controlling the spread of germs and disease. Kitchen equipment, kitchenware, utensils, dining tables, diaper change tables, and toys are required to be washed and sanitized. The process for doing this differs a little depending on items. Kitchenware and utensils are washed, rinsed, and sanitized in a 3-step process. 1. Washing in soapy water that is at least 120 degrees in temperature. 2. Rinsing in clean water in a second compartment. Then 3. Sanitizing in a third compartment. Sanitation can take place by placing silverware and utensils in 170-degree water for 30 seconds, or placed in a solution of 1 ounce bleach to 4 gallons of water for at least 1 minute. The ware and utensils can also be cleaned and sanitized in a dishwasher that maintains a water temperature of 150 degrees. Dining tables are sanitized before and after meals with a solution of 1 ounce bleach to 2 gallons of water. Toys capable of being put in a child's mouth are washed, rinsed, and sanitized with a solution of 1 ounce bleach to 2 gallons water. A dishwasher may be used to wash and sanitize those toys capable of being placed in a dishwasher. Diaper change table. A diaper change table is sanitized after each diaper change to ensure no passage of bacteria or germs from child to child, with 1 ounce bleach to 1 quart of water. This solution is mixed daily to maintain full strength. Hand washing is the most important way to reduce the spread of infection and disease. Programs that have implemented hand washing training programs for staff can reduce the incidence of diarrhea, illness, and other communicable diseases. Children's hands are required to be washed with soap and running water at the following times: before and after eating meals or snacks, and after using the restroom. In addition, staff should also consider the following as important times for ensuring children's hands are washed: after sneezing and wiping their nose, after handling animals, after playing in water or playing outside. Staff are required to wash hands with soap and water at the following times: before handling food, after diapering a child in a daycare center or group family daycare, after working with soiled clothing or bedding, and after using the restroom. In addition, staff should also consider the following as important times to wash hands: after handling body fluids, before and after eating or feeding a child, after handling animals or animal waste, after sneezing or handling a child's sneeze or wiping of nose, after handling the garbage, before and after administration of medications. Center staff can use hand sanitizers throughout the day, but these are not a substitute for washing with soap and water. This concludes our training video. Thank you for your time, attention, and commitment to providing outstanding care for the children of South Dakota. Please refer to this video anytime you'd like to refresh yourself or your employees on the information we've covered. You can also visit the South Dakota Department of Social Services website to download a comprehensive handbook that contains all the information we've run through during the course of this video, as well as other helpful resources.